Great. Good afternoon, everyone. Thanks for coming. This is the provider webinar for the NCI IDD Staff Stability Survey, NCI being National Core Indicators. The NCI sort of national entity did sort of break up, so you'll see now NCI IDD being differentiated from some of their other surveys. The NCI, I believe it's Aging and Disability Surveys, is sort of a different separate entity with separate people working on it. So many of you may know me. My name is Olivia Popiel. I've been working on this project for OPWDD for the past few years, and I'm really in charge of sort of the day-to-day operational end of this survey, as well as the other NCI survey that we participate in for OPWDD. So my colleague Kira Mir is also with us. She's going to present some of the slides. We're going to sort of tag team it. So Hira, if you want to introduce yourself.
Hi, everyone. My name is Hira. I work closely with Olivia, and like Olivia said, while she manages the day-to-day functions of the NCI National Studies, I support more of the data analytics and research efforts. And I'm really excited to share with you all some of the results from last year's survey and other efforts that we have to make this data actionable and usable. So thank you.
Perfect. So brief agenda of what we're going to go over today, just sort of a general overview of this particular survey project. Most of you here probably already know quite a bit of that part, where we are in our current survey cycle. So in collecting our 2021 data on our DSP workforce in New York State. And then we're going to go over the results of last year's survey efforts. So that will be the 2020 data, the data that we collected really over that first pandemic year. And just as an FYI, a lot of these figures that we're going to be presenting to you with the data, once we get it approved and sent through the proper channels here at OPWDD, is available publicly now on the OPWDD website. So if you need more information about how to access that, just send me an email and I can help you find where on our website a lot of these sort of general staff stability survey metrics can be found on the public OPWDD website. So the staff stability survey is one of 3 NCI surveys that are administered in the intellectual and developmental disability field. We participate in 2 of them. So we at New York State, we participate in this survey, obviously, as well as what's called the in-person survey for people with intellectual and developmental disabilities. So I'm also in charge of sort of the operations of that as well. So if you have any questions or are curious, you can reach out to me. Staff stability survey, last we checked, it was about 26 states participating in it. I think that may have gone up a little bit, but so that really represents over 3,600 voluntary provider agencies across the country. So really is the best data set for our DSPs that's available. So this will be our 6th year of participation. As you know, obviously we're in year 2022, but this 6th year, it's always kind of a year behind in the data. So we'll be collecting data on calendar year 2021. Many of you have already submitted it or are maybe working on it at the moment. And so we are collecting data currently that represents calendar year 2021. So it can be a little bit confusing when we talk about the 2021 survey that we're obviously working on this year in 2022. For the purposes of the staff stability survey, obviously, being a national survey, we have sort of a general national definition of what a DSP is. This should all be spelled out to you in those first few pages of the survey. But for our purposes, it's defined as, any paid staff whose primary job responsibility is in, providing DSP work. So any direct hands-on services or supports to individuals with developmental disabilities. And, they might also act as a supervisor or some kind of clinical staff, but if they spend at least 50% of their time doing sort of direct service tasks for IDD individuals who are adults, who are legal adults, 18 years of age or older, then, they can be considered a DSP for the purposes of this survey. And I know many of you who registered today have been doing this survey for multiple years now, so you might be familiar with that definition. If there's any questions about that, here, and I can always work with you to kind of help you figure out, you know, who your DSPs are. So yeah, this is really the only data set that gives us a very aggregate, large scale data on some of the workforce metrics that pertain to DSPs. We're going to go over what those are with our 2020 figures. So things like turnover rates, wages, vacancies, and all kinds of benefits that might be offered, and how many of those DSPs are even enrolled in those benefits. Things of that nature, all of your, payroll and HR data. It's really what's collected in the survey. So again, to be eligible, we always get questions about this, and I know after the pandemic, a lot of people's eligibility may have changed. So very simply, to be eligible for the accessibility survey, your agency must serve obviously adults. It is adults 18 years of age and older, so sort of the legal definition of an adult with an IDD, and they had to just have had DSPs on payroll during the calendar year. So this year, obviously, the date to kind of base it off of is December 31st of 2021. Your agency also had to have been in operation for 6 consecutive months during that calendar year. This became a little bit complicated for some agencies during the pandemic. And then just at least one of the following supports, very generally, residential and non-res or in-home, really any kind of services or supports where you're hiring DSPs supporting folks with IDD. So again, as I kind of talked about, every year that we're administering the survey, we're collecting data on the previous year. So here you can see our response rates for the last 5 years that we've been participating. These are really, really good response rates. We really have all of you providers and our great provider network to thank for these response rates. It's not actually a mandated survey in the state. We just have a lot of good response from providers. So we have you to thank for that. And that's part of why we're doing these webinars, to really try to equip you with what you're equipping us with, which is a really good data set on our voluntary DSP workforce. So this year, as I kind of already went over this, but it's 2022, but we're collecting data from last year, 2021. We did send out the original invites on April 29th. I know, there's maybe some people didn't get them. Maybe it went to a junk or spam mailbox. So obviously I'm still available. You can email me or call me if you need that link resent to somebody else. Our due date's towards the end of next week, June 30th. And I think the response rate has gone up a little bit since we put this slide together. I think we're at least 15%, but as I found in managing this survey, a lot of people really fill it out that final week. So hopefully we'll see a lot of people completing their data next week. And I did notice that a lot of people are in the started category, so I'm optimistic. We've been getting a lot of good, emails and questions, and people calling and asking for their survey link. So again, really want to thank the providers who have been filling it out year after year and help equip us with this data. So you do complete this survey online. A lot of times, agencies ask me to send it to a HR director, someone sort of in their workforce division, someone else in the HR team. I can always resend it to however many people. It doesn't matter. You do have a unique link. And then anytime you kind of click the next page in the survey, it should save the data that you input. So even if you're forwarding it around through your organization, it shouldn't be a problem. I do know a lot of agencies like to print out the PDF just to kind of know what they're going to need. So we're happy to kind of support. There is an option to download the PDF and one of the first few landing pages. If that's how you like to work, printing that out might be helpful. If you've taken the survey before, it might just take a few minutes. Maybe you have all your data kind of ready to go, but it usually takes about an hour. I know at the end it kind of asks how long it took you to complete. We get a pretty wide range of responses, but usually within an hour of actual time sitting down and doing it. So yeah, if you're having any challenges or questions, you can always, if it's an item that you don't have the data for, you can always submit your survey without that particular data point. We would rather that we get some information on your agency and your workforce than none at all. So yeah, that's that. Um, Very briefly, survey sections. I'm sure most of you are used to this, but so agency profile, it's going to ask what kind of supports your agency offers, the number of people in those supports, and then, most importantly, kind of our payroll data, how many DSPs you have on payroll, how many overtime hours they worked within that year, your number of vacant positions, how long those DSPs have worked there. We just added, I think last year or maybe even this year, a lot of demographic information on your workforce. So if you have the ages of your DSPs and your frontline supervisors, as well as their genders, it does ask for that. And maybe, if that's something that agencies commonly don't have in their data, that would actually be interesting for me, for us to know as we kind of develop this tool. So anything that you don't have, if you want to, you obviously leave it blank, submit what you do have, and then send us an email about it. It's always informative for us to kind of know what your data looks like at the agency level. And I know it varies quite a bit. So compensation, wages, things like your starting wage, ending wage, we then, use that to calculate sort of an average wage by region, information about bonuses and benefits, and then any recruitment and retention efforts that your agency may be initiating. We have added a number of state-specific questions to try to get more information on some of those, extra benefits and some of those retention efforts. So that's pretty much it. This is, these basic sections have been the same for a number of years now. There are slight tweaks to them, but the majority of changes to the survey have been in our state-specific questions that we've added. So at this point, I think we're going to pause, and if anybody has any questions about filling out the survey this year or the timeline that we're working with, I think this would be a good time to kind of get to those. And here, if you don't mind helping me read if there's anything in the chat.
I don't see any questions right now, but as we continue with the rest of the presentation, please submit your questions in the Q&A and we will revisit them at the end of the webinar as well. So we can take a few minutes to see if people will submit any questions,
Okay.
maybe a minute or two, and then we can move on.
see something. So,
Yep, so
go ahead.
the first question is, I assume they're saying, when should we include DayHab specialists, job coaches, and ComHab staff as DSPs? So I can answer that question, Olivia, and then if you want to add something to that. So there is a section in the survey that does ask for some information about DSPs who are serving, in providing employment services. So these DSPs, day have specialists, job coaches, ComHab staff, most likely they will fit the definition of DSP per the staff stability survey. And if you do specifically hire in these areas, there is a part of the survey that says, do you differentiate their wages? So is there a different wage for your job coaches? Is there a different wage for your employment specialists? So you should be including them in your overall numbers for DSPs, especially if they fit the overarching definition of, they're spending 50% of their time, their paid time supporting adults with IDD. So most likely they will fit that definition, and you might even be able to differentiate specific DSPs and submit their wages, separate wages, if that's the case. If there's a certain, Lori, I'm looking at your question, if there's a certain nuance that you feel is not being captured in my answer, feel free to message me and Olivia. I think you probably have our contact already, and we can work through the nuances, but you should be including DSPs who provide, job coaching, community hub. You should be including their information in the data set. You are welcome. I see that you said thanks. And then John Good asked, are DSPs working only through self-hired, self-direction, not counted for this survey? But before I move on, Olivia, do you have anything to add to the DayHab employment?
No, I think that captured it. Yeah.
So then for John's question, are DSPs working only through self-hired / self-direction, not counted for this survey? And so I can answer that, Olivia, and then you want to add to it.
Sure.
So again, if there's a specific nuance at your agency, we can, connect one-on-one and help you figure that out. But there is a part of the survey, one of the first pages, that does say that if the DSPs are hired by the family member or by the family or the person receiving supports, they would not be counted for this in this survey. So self-hired DSPs would not be counted and would not fit the definition. So it would only be a DSP that is hired and paid through the provider agency. And they might be providing some sort of self-direction support, but self-hired DSPs are not included in the NCI IDD staff stability survey. I know there can be some nuances to the hiring and the payroll related to self-direction. So again, John, if that doesn't answer your question and you feel like there's something specific, we can work with you one-on-one, through email or phone connection to figure that out. And Olivia, do you want to add to that?
No, that's pretty much, that would be my answer. Yeah, if you're directly hiring them, then they can be considered if it's a fiscal intermediary situation, self-hire situation. Most agencies are not counting them. And I don't think they fit the definitions. I know there's language at the beginning of the survey that tries to spell this out, but again, it's kind of like national, very generic language. So sometimes it's hard to figure out where we fit in. And I know like in New York State, we kind of have our own terminology for things that we expect to see. But yeah, basically if your agency is directly hiring them, then yes. But in most cases that people are asking about, it seems like it's a self-hire or your financial intermediary. And
Okay, those are both really good questions. So please keep submitting them if something comes up as we continue to present, and Olivia and I will try to get to all of your questions, hopefully.
Yep. And now we're going to get to some sort of the more fun stuff, which is the data that we got last year. So here, I think you're going to take over for a few slides. See how here we go.
All right. So Olivia just went over some of the administrative aspects of the survey and the history and response rates that we've had, the incredible response rates that we've had for this voluntary survey for the last 5 years. And so we also wanted to take some time to present to you what we've learned about the direct support professional workforce, specifically what we learned based on the 2022 data set. So this was the data set that you all, the survey that you all participated in last year. So it would have been the 2020 staff stability survey representing data from 2020, but you completed it last year in 2021. And so what you have in front of you is the cover page for the national report that is released by National Core Indicators. So if you go to nationalcoreindicators.com and go to the staff stability section, you'll be able to find this public report that represents data from the 26 states that participated in the staff stability data set. That includes Washington, D.C. And over there, you'll be able to see how New York kind of compares to some of the other states in terms of all the metrics that Olivia explained in one of the previous slides, you know, the number of wages, the types of supports that are provided, how many providers are providing certain recruitment and retention benefits. And so that report is released every year by NCI. So that data, those findings are made available to you every year that we participate in the survey. So next slide. And so from that report, our team, you know, me, Olivia, and some of our other really incredible colleagues at OPWDD, we do release a New York State executive summary. And some of you might have seen this, you know, we've been sharing it with you for the last few years. And now, as Olivia mentioned, some of that data is on our website as well. So we try to highlight some of the key metrics and some of the specific analyses that we do here in New York State. And so I'm going to share some of those with you now. So one of the really important things that we've been able to do with staff stability, like I said, is produce these high-level metrics and show data at a glance for NCI staff stability in New York State. And so what your participation in the NCI data set allows us to do is to really paint a picture of the New York State provider workforce and that of other states so that we can compare our rates, compare our wages, our vacancy, our turnover to other states. And also take a look at what's going on across the country in terms of the direct support professional workforce. At OPWDD, and I'll present some of the results to you, we've also been able to do some further empirical analyses and regression analyses that are posted on our website, really taking a look at what factors impact tenure over time. And so you might have been familiar with work that the University of Minnesota has done or NCI has done on really using this data set to uncover how can we really support the direct support professional workforce and how can we, you know, impact for the better our vacancy, our tenure, and our turnover rates. And this data set really allows us to unpack and answer that question. And lastly, you know, several states have built interactive Tableau dashboards. And again, some of the work that we have done on Tableau and some of the knowledge that we've uncovered is on the OPWDD website right now. And because we participate every year and have been participating every year for now, it'll be 6 consecutive years, we are able to present data annually and take a look at what's going on an annual basis. The next slide. So now getting into the results of last year's participation. So this again represents the 2020 calendar year. We had a 73.4% response rate. 223 providers were surveyed, and the data set that we obtained through your participation represented 55,033 DSPs. And just taking a look at a glance in the data set, it was represented that about 63.5% of DSPs in the voluntary provider workforce are full-time and 36.5% are part-time. And so those are the latest results that we have. This is one of my favorite histograms that comes out of the staff stability survey. And it gives you a sense of the distribution of the workforce across the providers. So we have, like I said, 223 providers. And this gives you a sense of how large the agencies are in terms of how many DSPs they hire. So really, we find that approximately 72.4% of the providers who participated last year employed less than 300 DSPs. We do have some really big providers, as you can see towards the right end of the histogram. We have 6 providers who hire over 1,000 DSPs and 1 provider who hires over 2,000 DSPs. So we have some really large providers, but the majority of our providers employ 300 or less DSPs. And I think this is a really incredible bird's eye look of the provider workforce. And this, as Olivia mentioned, the first part of your survey, agency profile, asks you, what type of supports do you provide? And then there's a drop down of how many people are supported. Do you support 1 to 2 adults? Do you support 11 to 20 and so on? And so the summary result here is that 50% of providers support 100 to 499 adults with IDD. And so as we saw in the last slide, that shows you how many DSPs you all hire. This one shows you how many people you support. So it's just an incredible kind of bird's eye look at the New York State provider DSP workforce and your responsibility to serve people with IDD. Olivia mentioned earlier in the presentation that some of the new information that we started collecting really this year and last year is more demographic information about the direct support workforce, so specifically age. And what I really like about this information is some of you who are in the workforce and maybe are working on training and education for DSPs, that there are several different generations at work together in the workforce right now. And I think this data really lends itself to that observation. You can see that you have 28%, almost 28% of the workforce is ages 25 to 34. This is specifically DSPs, but you have 20% of the workforce that is over the age of 55. And then you have some of the newer generation of people under the age of 24, and that's 16%. So again, all this data is available on our website. I think it's really worth taking a look at. And just to reemphasize, this is what we're doing with the information that you're giving to us. It's just really incredible to think about the workforce from this perspective. The next slide. This, in contrast to the last slide, so the last slide was about the age of DSPs. This is about the age of frontline supervisors. And just at a glance, it seems like the average age of frontline supervisors is a little bit older than DSPs, and that probably makes sense because of seniority and years of experience. Supervisor oversees DSP, so that probably makes sense. But again, not as much age diversity, but still a lot of generations at work in the same workplace. So really interesting there. So 28.6% are in the category of 25 to 34 years of age, with 17% being over the age of 55. So not as diverse in age as the DSP workforce, but still quite diverse in terms of age group. And another piece of information that we started collecting last year and this year is gender and race of DSPs. And 71.4% of DSPs are female, according to the 2020 results, with 26.9% being male. 41.3% of DSPs are identified as Black or African American, with 37.4% who identified as white. And so next slide. Similar to the trends that we see in terms of age, the race of frontline supervisors and the gender of frontline supervisors, there will be less diversity there. But one of the things that you won't find in the national report, this is the New York State specific analysis, is taking a look at race by the OPWDD DDRO regions. And the reason why we did that is because those of you, who work in New York State know that the region and the makeup by zip code really impacts, racial diversity and people's backgrounds. And so we wanted to take a look at race by the DDRO regions, not just at a New York State glance. This gives you a more nuanced perspective and more detail in terms of diversity of DSPs across New York State. So again, this is all available on our website, and you can take a closer look if it's interesting to you or useful to you. And so when you take a look at the gender and race of frontline supervisors specifically, you'll see that 48.3% of frontline supervisors identify as white, with 33.2% identifying as Black or African American. And so similar trends to DSP workforce, but a little bit more racial diversity can be found in the DSP workforce. And this might sound, familiar to you or things that you might have observed in your own agency. But again, this is incredible information to have at a glance for all of New York State. So you can go to the next slide. And again, we have the race of frontline supervisors broken down by DDRO region. It's just a New York State specific analysis that you won't find in the national report because other states don't, have this regional breakdown. So we have it conducted for our state. Next slide, please. I think, Olivia, I'll turn it over to you.
Yeah, so one of the things that we really look closely at with the staff stability data is tenure. So how long, obviously, your DSPs have been working or did work in the case of separated DSPs to the right. So for our tenure of employed DSPs, we did get, that over 50% of our DSPs have been employed for just 3 years or less. We know that it's quite an investment on a lot of provider agencies to onboard and to train DSPs. So when you think about, not just what it means from your perspective of the investment of the employee, but also what it means for the people receiving services, that there's, quite a bit of turnover of their people supporting them, it, really is a dilemma in our field. We also collect the tenure of separated DSPs. So meaning when you answer those questions about, how many DSPs left within the past year, we are collecting data on how long they stayed at their job. So in 2020, 40% of our DSPs who left, had been employed for less than a year or a year or less. So with, those two first categories, less than 6 months and 6 to 12 months combined, that's a significant portion of DSPs across New York State. So I know that this is something that we think about a lot in terms of, how to incentivize people so that they're, not, for example, taking that bonus and leaving. This is something that's just a really important metric that we really only have staff stability survey as a way to collect it for our voluntary provider network. And I'm trying to go to the next slide. Okay, so vacancy, obviously, we also collect vacancy rates. In 2020, we found that just over 20%, 21.3% of part-time positions were vacant, and 17.2% of full-time positions were vacant. Might not sound like huge percentages, but you can just imagine, and I'm sure you all know better than I do, the strain that this puts on your other staff who are employed. Turnover rate, we obviously, break that down as well by our OPWDD regions. So our state turnover rate in 2020 was 35.6. But you can see that broken down by region as well. There's quite a bit of variability when you look at the turnover rate in Region 3. So, here in Albany and the Hudson Valley, the Eastern, I believe that's Region 3, compared to Region 1 and 2, which has a pretty high turnover rates. But of course, they're all significant. So that is vacancy and turnover. Kira, did you want me to do the wages?
Yeah, you can do that. Yeah.
Okay, sure. So of course, we also collect data on wages. In 2020, we did have a statewide average hourly wage of $15.79. But of course, it's very important to look at that by region because, as you probably know, we did, and I believe still do, have different um, minimum wages across our state. So the range in 2020 was from $12.50 per hour all the way up to $24.86 per hour. So it seems like a wide range, but it's not huge when you calculate the average. Most DSPs across the state are making around that same average, even in our different regions. So region 4 here, I believe, is New York City, the 5 boroughs, $16.29, only a little bit above what the minimum wage is in that particular region. And I think we have a graph where we're gonna, yep. So when you look at the relationship between what is our minimum wage and what DSPs are making on average. Of course, there's an average. We sort of put together this little infographic to show that we did have 3 different minimum wages in New York State for 2020. So New York City was up to that $15 an hour, and as you can imagine, that's also the region where we saw the most agencies reporting that same rate as the minimum wage. So if you look at the Region 4 bar, there's 11 agencies that were paying that minimum wage, and a large percent of the agencies in Region 4 are paying between 1 and 20% above the minimum wage. So think of like percent above, it's probably only like 10, 15 cents more than the minimum wage. So yeah, quite a bit of variability here, and we really have to pay close attention to this one, as we do have minimum wages, as we have obviously during the pandemic wages, changing all the time. So let's spend a little time just kind of trying to digest this for people. I know this one can be a little complicated. So this is the number in the bar is the number of agencies, or the number of provider agencies that fell within that category, and the colors represent what percent above their minimum wage, which is different by region, they reported as paying. So 2020, and this is going to change, hopefully get a little more simpler in 2021, when I think we have fewer minimum wages active. More of us have made it up to the $15.
So in this next infographic, what we did was we took a look at the ratio of DSPs to frontline supervisors. And this is our way of understanding kind of like the support that DSPs have on the job. And so similar to the competitiveness of the wage that Olivia was talking about in the previous slide, you do see a lot of actually variability across the regions in terms of DSP ratios. And so across New York State, the average ratio of DSP to frontline supervisor was 11-1, which means one supervisor was overseeing and supporting and supervising 11 DSPs. But when you take a look by region and you do a regional analysis, you see that there's a lot more nuance and a lot of variability across the region. So, just taking a look, for example, at Region 4, again, the 5 boroughs of New York City, you have 18 agencies that actually have more than 14 DSPs per frontline supervisor, and several agencies, 26 agencies, having 1 to 8 DSPs per frontline supervisor. And so, you can make an assumption here about those agencies who have 1 supervisor managing more than 14, and you find agencies like that across the 5 regions, what that workload might look like, and some of the implications of that, like Olivia said, you all know that perhaps better than we do. So again, another interesting analysis that the survey data allows us to complete. And so another section of the survey that yields some really meaningful and important information is about benefits, specifically health insurance benefits and other health benefits. So according to the 2020 survey results, 78.4% of providers offered all three dental, health, and vision insurance to their DSPs. 63.4% of providers said that DSPs were eligible, or 63.4% of DSPs were eligible for health insurance. However, the third pie chart that you see says that only 30.9% of DSPs were enrolled in health insurance. So while 63.4% of DSPs are eligible, only 30.9% are enrolled. And so that's just interesting to think about. And I'm sure there are a number of reasons why DSPs are not enrolling in the provider health insurance. And in a similar way, for the next slide, there's a section of benefits that basically just asks you to check off the number of other benefits that are offered. And in the last 2 years, we've also started to ask again, how many are actually enrolled in this benefit. So in terms of employer-sponsored disability insurance, 74% of eligible DSPs are enrolled in employer-sponsored disability insurance. But when it comes to flexible spending accounts and post-secondary education benefits, for flex spending, only 12.1% of eligible DSPs are enrolled, and only 15.4% of eligible DSPs are enrolled in post-secondary education benefits. And so this is, interesting, something for the provider network or any kind of employer to consider is, you might be offering a benefit to the majority of your DSPs, maybe almost 100% of your workforce, but what percentage is actually enrolling it? Is it an attractive package, or are there other circumstances that are influencing the person to not enroll in that benefit? Maybe they have better benefits through their spouse, or maybe this is their part-time job, and they just have better benefits elsewhere. So, I'm sure we can list a number of reasons, but again, this is really interesting information to have for the provider workforce, the DSP workforce across New York State.
So I'm not sure where we are now at 2:45. I think we made actually perfect time. But this is where we were gonna close out. We can send you these slides to all registrants. PDF of these slides will be made available. We do have the website here where you can get that full report. So that's going to be all of the little infographics, all the little charts that you saw today, and a few other ones, I believe, on the OPWDD websites. And yeah, any other, we can pause for questions, but of course, this is our new Accessibility mailbox where even if I'm out here or someone else on our team can check it and bring my attention to it, and we have that available to you at any time, really, but especially at this time of year when we're collecting survey data. So yeah, I guess we'll just pause here, and if there's anything else coming in the Q&A, we will address that. Rachel saying she had a hard time matching numbers referred to in question 20. Okay. So yeah, someone else kind of mentioned this, that, those questions where you're supposed to add, numbers of staff or numbers of hours or whatever the case may be, don't equal up or something. And, that's fine. We do a lot of cleaning of the data, and trying to make sense of the data. And sort of, you'll see those little asterisks in our infographics, to kind of make the best sense of it and make sure, that it's as reliable as it can be. So if certain numbers aren't matching up, my answer to that would be that we completely understand it. We'll probably just omit the figure that isn't matching up, and like not report on that specifically, and sort of our communications to leadership and our the data briefs that we put together that, we try to share with you as much as possible. We will,
I think
yeah.
this is the question by Rachel about having a hard
Yeah.
time matching the numbers referred to question 20. I think that's the payroll section with furloughs. And yeah, I would just want to reiterate what Olivia was saying. The survey does try to guide you through numbers matching, but if they don't, and it's really characteristic of your data system, I think it's okay. We can figure it out on our end as long as the information is there, we can try to understand the numbers and match them up through our data cleaning process. But Rachel, specifically, if you feel like there's something unclear in the survey itself, or there's something that we can help you with, I say it's better to connect one-on-one on this so that we can actually, walk through the survey and take a look maybe at the numbers. But if they don't add up, you can still continue with the survey, right? Even if I think maybe you get like a little flag that they're not adding up, but you can skip and continue, right, Olivia?
Specifically, if they're not adding up, I'm not sure. I think it might not let you continue. It might flag. I don't know. I can test that and get back to you.
Okay.
But yes, but I would say if that's the data that you have and it's not adding up, I would leave the like total number blank if it's not letting you proceed to. So, submit what you have and then just leave out that like bottom, sum or total. Um, if if that's what you have to do, because then we can, when we do our data cleaning, add the numbers that you submitted. Does that make sense? Sorry, that was a little awkward. And then someone asked when the PowerPoint will be set out. I believe we're gonna do it this afternoon, right? Right after
Yeah,
we
I don't think there's any delay in that.
shouldn't be too much of a time delay. Hopefully you'll be seeing it by close of business.
And I
Yeah.
did also want to just give a heads up. When you do go to our website, you're going to see a more accessible screen reader compatible version of the data. So don't be alarmed if you click on that link and then you see that the visuals look different than what we've presented in the slideshow. All the information is there with matching visuals, but they're actually made for the website and for someone who might be using a screen reader. So they are going to look a little different, but the representation and the actual data will be the same.
Numbers should be the same.
Yeah, the numbers will be the same.
And then also, if you're, for whatever reason, interested in the national report, interested in looking at other states' data or the national averages, that would be, I think it's just nationalcoreindicators.org, and then you sort of click staff stability. So that would be where you can access that. Obviously, that won't have things broken down by OPWDD region, and our report is a little more comprehensive, just in the sense that we have things like our state specific questions that we've asked on, a lot more of that demographic information, the enrollment information about certain benefits that we've asked for specifically in our state that the national survey doesn't ask. So yeah, all of that is available to you.
I don't see any other questions coming in.
All right. So at this time, we are going to close the webinar. As I mentioned, there's this email address at the bottom of your screen, NCI staff stability at opwdd.ny.gov. I know a lot of you have my email. You can also email me directly. That would be olivia.g.popiel@opwdd.ny.gov. Obviously monitor both inboxes, so it doesn't really matter. But yeah. And I think that's it. Thank you so much, everyone, for coming. And thank you to those of you. I know we have over 40, probably over 50 now, providers who have submitted a completed survey already. So we are really, really appreciative of that and how much commitment you've shown to getting this data in.
All right, thank you, everybody.
Thanks. Have a great afternoon.